My dear friends, we have Dr. Sridevi today, the obstetrician and gynecologist. Let's learn from her increased amount of fluid in the uterus during pregnancy. What is the reason and what is the complication because of that, Dr. Sridevi?
Thank you. So the increased fluid is known as polyhydramnios. That means normally the amniotic fluid, there should be a certain amount. But what happens is there is excessive. So when you say excessive, how much is excessive? So more than 2 liters, that is 2000 ml. Or when you measure in the ultrasound, we measure something called as amniotic fluid index. So when that is more than 25, or when that is a sum of 4 pockets in 4 quadrants they will see, and that total, or in one quadrant itself there is more than 8 centimeters. Under these criteria we call it as polyhydramnios. So what is the problem? What causes this polyhydramnios? So first commonest cause is diabetes. So in diabetes what happens is the blood sugar increases, so the blood sugar of the baby increases. So since the blood sugar of the baby increases, actually what is this amniotic fluid is the baby's urine, the fetal urine. So what happens is there is polyuria. So since there is polyuria, that is increased urination, the fluid increases. Another condition where there will be increased urine, that is in multiple pregnancy, that is when there are 2 babies. So, and also when there are any congenital anomalies, that is usually what happens is the liquor has to be absorbed. But now that is one, the production is more in these conditions, or it's not absorbed. So where it isn't absorbed is in neural tube defects. So what happens is the baby usually swallows the fluid. Here the swallowing is affected. In those kind of fetal anomalies, again you will have polyhydramnios. So when there is increased liquor, you should look for the cause. Why is the liquor more? Why is the fluid more? So depending on what reason the fluid is more, you can treat that. So what are the complications? What symptom does it cause? Since the fluid is more, what happens is the abdomen becomes very enlarged. That is normally if you're 20 weeks, that is around 5 months, you may look like 7-8 months. So what happens is there is a breathing difficulty because the uterus is much more bigger, and there is pressure symptoms, we call it. What is pressure is? It presses on inferior vena cava, that's a vein. So because of that we have pedal edema, that is the swelling of the legs may be there. There will be more urge to urinate, and immediately you feel like going to the bathroom. The sleep may be very disturbed. You cannot change positions. You moving around and walking may be difficult. So these are some of the pressure symptoms because of this. So more importantly is we should know why, the reason, and accordingly it has to be treated. Now coming to the treatment, once in labor, what happens is if the fluid is more, when you don't want the fluid suddenly, all the fluid to rush out. So what you do is when you do a rupture of membrane, when you want to rupture the membrane, you have to do it very, very carefully, and you have to let the fluid little by little out. So that is controlled ARM, we call it. So what happens? Nothing happens to the baby is still fine, and delivery will progress as normally. Before that, if there's very excessive and you want to remove it, also by ultrasound you can remove a few ml of fluid, but not everything at one time. It has to be done slowly.
Yeah, ARM doctor said that is artificial rupture of the membrane. High rupture they do. High rupture of the membrane. Suddenly rupture, what can happen? The umbilical cord which is attaching the baby's abdomen to the placenta, that comes out, it causes contraction of the vessels. The baby will go for hypoxia, oxygenation will become less. Baby can die. That is why you have to do a controlled contraction. So what is the patient has to know? When excessive fluid, you better get admitted in the hospital. And according to the doctor's advice, they remove some of the fluid if it is very early. Otherwise, they admit in labor ward. Immediately, they should have a facility. If a membrane ruptures and suddenly the cord comes out, probably they have to treat immediately. That is the reason we have to be very careful. This is about polyhydramnios, or increased amniotic fluid in the uterus during pregnancy. Okay, doctor. Thank you very much.
Thank you.